All right, I'm going to wait a couple minutes or so we get the streaming feed going and see if anyone else comes on in.
Does this go until noon, or is that time?
What was that again?
Does this session last until noon, or is that time?
It is until noon. Yeah, we may not go all the way till noon. We'll go about 2 hours though. Yeah. All right, welcome everybody. Welcome everybody that's tuning in virtually as well. We're going to talk about clinical oversight reporting. We'll go for a couple hours or so. We'll have plenty of time to really sort of dig into some dashboard reports and other reports as well. If you don't know who I am, my name is Tim Proctor. I am a product owner at PCC, and I work on a development team that's been focused on reports and building some new reports within our EHR report library. I also have experience working with our dashboard product. I've done some development with that. Our forms product, we have a team working on that, or that has worked on that as well. So let's talk about clinical reports. Here's what I'm hoping that folks will get out of this session. It is meant to be an introduction. I'm going to kind of run through many different reports. We'll have time for me to get in there and run some of those reports and look into the dash. We're going to actually get logged into the dashboard. I'll walk you through many of the clinical measures in the dashboard too. We'll talk about how to do recall, how to generate lists in the report library. But it is meant to be an introduction. I'm happy to take questions throughout. So if you have questions here in the room or virtually, feel free to ask, and I can address those as they come up. I'm hoping that you're going to get a recognition of areas of your practice that you feel need more oversight on the clinical side of things. At the end, so think throughout this session what areas you think you want to focus on when you get back. At the end, I'm going to ask folks just to share just some areas that they think, after seeing a lot of these reports, what you may want to take a closer look at. All right, so that's what I'm hoping folks will get out of this. Here's just a summary of all the different types of reports we're really going to get into in this session. We're going to start with some operational reports, some clinical operations oversight, and we'll talk about some phone messaging and portal activity reporting and vaccine inventory management, patient communication reporting, how to generate reports on orders that you're generating, and prescription and some lab reports as well. We're going to move on and talk more about strategic oversight reports, and that's when we're going to get into the dashboard. The dashboard is really meant to be high-level strategic reports, clinical measure reports. We're going to talk through many of those as well. And then finally, we're going to get into population management. So I really want to focus on this and just make sure folks know how to identify patients that are due for various services. All right, so the first set of operational reports I want to talk about relate to phone encounter response time. So in the reports, and we have a screenshot here of where you can find this report. If you ever wanted to monitor phone encounters at your practice, and more specifically, the amount of time it takes to respond to the first task generated from a phone encounter, we have a report that's designed to show you that. If folks have done PCMH recognition, patient-centered medical home recognition, this is one of the things they want you to be able to track for your practice. Like, how quickly are you getting back to patients for initial phone calls? When you run this report, you'll see a criteria page like this where you can specify a time frame, a date range, and then some task types that you may want to see response time for. So you would select tasks related to related to the need for callbacks, like doctor's attention needed or callback needed or something like that. And when you run the report, I don't know if I have so this is the output of that report. When you run it, you're going to see just a list of phone calls with some information about task completion time, or the first task related to the phone note, completion time and response time. So it's a old report. It's not in the report library, so that's why you see it separate in that reports menu. The output looks a lot different than report library reports. But you can see this, and I just want to mention this if you wanted to track phone encounters. We do also have in the report library other phone encounter-based reports where you can specify phone encounters, but you won't see the calculation of response time for a task in the report library. Portal message response time. So this one lives in the report library. It's called portal message response time, and it's used to track the time between the receipt of a portal message from the patient and the response back to the patient. So it's meant to show how quickly you're responding to portal messages coming into the practice from patients. Okay. So again, another report that some folks need to use. If you're doing PCMH recognition, NCQA asks you for your practice to track response time to messages like that. I want to mention some other portal administration reports. In the report library, under the patient portal category, we have a dozen or so different reports that you can run. I just want to mention a few of them here, which can be useful. They're listed here: portal user and activity audits, payment details, portal payment details to see the portal payments coming into your practice from patients, portal message audits, patients, reports that identify patients who are or are not using the portal. So I'll go through some of these reports and explain the purpose of them. The portal user and activity audit report, you can identify for both portal users and their connected patients. You can investigate a little bit more detail about the activity for specific patients and portal users. So if you have ever a question of when did a portal user log into their portal, when did they log in and view the portal for a particular patient? If you wanted to get sort of a log of that, we have portal activity for a patient. You can get into information about portal users linked to a patient and login and access details, who's connected to a specific patient. A portal user list is a larger audit report of who has been created and added to the portal user list during a specified period. So these are just detail about portal use for specific families or for specific patients, or just general user lists. Patients who do or don't have portal users. So this first report will give you a list of patients who do or do not have portal access, or do not have portal users. When you run that report, you can specify, show me patients with a portal user connected, show me patients without a portal user connected. That can be useful for sending broadcast message. So if you want to reach out to families of portal users, so not all families that may not have a portal account, but those that do, and you want to reach out to them, for example, to announce that you're doing pre-check-in, you're starting pre-check-in, or things like that, that report can get you that list of patients. So it can be useful for identifying which patients have a portal user connected. Portal users by appointment date is useful for determining who needs a portal user added ahead of an upcoming appointment. So if you're a practice that's just implementing the portal for patients and you want to really have your front office work towards getting patients connected to portal users, this will show who's coming in and if they have or do not have a portal user attached to them. Portal users by relationship. So I think for using Chattis, you need to have a relationship assigned to the portal account. And that report can be helpful for that, to identify who may not have a relationship assigned or who may need to have that fixed. Okay, so those are just some portal administration reports that I wanted to mention. Talk a little bit about vaccine inventory management. The QR code here goes to some documentation that we have on Learn all about vaccine inventory management. I'm not going to spend too much time going into that process, but I do want to highlight some reports that can be useful for vaccine inventory management. The first is inventory reconciliation. So this report can be useful for just making sure that the vaccines that you have in stock in your fridge match what the system thinks that you have for your lots that you've loaded into PCC. When you run this report, you'll see a worksheet like this, where you're basically getting a list of all the different lots and the expected inventory based on what you've stored in PCC and administered with PCC. And then you'll see these columns are blank at the end, and it just lets you fill this out as a worksheet to indicate if there's a difference there. Just a show of hands in the room, how many folks use this report regularly? Okay. Is there anyone here that does not do vaccine scanning in PCC or does not store lots in PCC? Because you do need to be doing that to be able to use any of these reports. But this is helpful for just reconciling and making sure that it's really all about making sure that you have your vaccines, that you're entering your vaccines properly, that you're not missing a lot or not missing something. All right. If you do not match the stock with what the report actually thinks was administered, you can use some detailed report like the immunization administration details that will allow you to see the details, all of the entries for a particular vaccine. Immunization administration counts will allow you to compare private versus VFC lots. And allow you and again, you can dig into the details report to get some details to determine discrepancies. So these are reports just that can be useful for making sure that you're not missing some vaccines and information being put in. All right, patient communication oversight. So I want to mention some reports that we have for overseeing broadcast message report or broadcast messages that you're sending out under the report library and communication section. We have reports that can show you, for example, inbound replies. So when you send broadcast messages, all right, you're sending messages to a ton of patients, maybe via text. Well, if they reply to that, where does it go? It gets stored in the database in PCC. The inbound messages report in here can identify all the replies that a family may have sent to a broadcast message. There's no other place to see those, right? You're not going to see those pop up on a messaging queue or anything like that. This report is the only one that you can use to see that. So it's good to know about that and good to review that on a regular basis, especially after you send a batch of broadcast messages. And then there's some other reports in here. The single text log is just a log of all of the single text messages that you may have sent to a patient. And then some other detailed reports there. The broadcast message log is just a log of all of the broadcast message batches that you've sent out. I think it gives you counts of how many were rejected or how many did not go through versus how many went through. So it's just a good way to review your broadcast messaging and just making sure that messages are going out okay and responding to replies that may come back in. All right. Any questions about any of those reports I just talked about, the messaging or portal or vaccine reports?
So do you think best practice is to look what people said to your do not reply text every day? You send text and it has a disclaimer, don't tell me anything, I'm not going to read this. But
Yeah.
do you think you should look every day?
So the question was, should you look at that reply log every day? I don't think so. I think it's like, it depends on how often you're sending out broadcast messages. I would maybe look at it after you've sent a batch of messages. It's probably good to look at weekly, because sometimes you're sending single text messages too. So it's good to look for replies on a regular basis, maybe not every day, but it depends on how often you're using it, I guess. All right, orders by visit. All right, this is a really, really useful report. For any order that you've created on your system, you can use this report to identify all of the occasions that you ordered that specific order. So when you run it, you'll see you can filter on order name. So this is for referrals, for screenings, any sort of order in our system. You can report on the uses of that, the instances of that. I've had people tell me that they're tracking like just things that they're doing in a visit or information they're giving out as an order, so that they can track how many times they've administered a certain handout or certain information. You can do that with a report like this. And this is really the only way that you can identify all of the times that you've done a specific order. You can give it a date range, you can give it a provider and location, so you have some filters that you can use here. But this is what it looks like. And again, you can show referrals. Referrals is probably the top use case for this, as you're doing referrals. If you want to see, show me all the referrals that are outstanding, that are still open, okay? You can see those with this, and you can see some details about them. So you have the notes, so you'll be able to see some further details. And if there's any tasks that have been created related to that order, all right, you'll see those here as well. Or the open order tasks specifically. So referrals, screenings, medical procedures, radiology, labs, along with their tasks, you can see that all with this report. So it can be really useful for just monitoring orders that you would have given. Okay. Test results report. All right, so how many folks use this or how many folks need to do COVID test reporting to an entity or any other lab test reporting? Is there any external reporting that happens? All right, I see a few hands here. This is a report that can be useful for that. And it shows a good amount of detail for any sort of lab tests. All right, you can see you can filter on specific tests. You can filter on date range and location. And you get your details like this. So there's a lot of information in here, including patient demographics and other information, but then test information as well, including the LOINC and results and interpretations too. So I know some people use this and have to report on COVID tests, for example, and generate a spreadsheet or CSV and send that off externally to, I don't know, where do you need to send those COVID lab reports for the folks that need to report on it, or other test reports? Where do you send those? The state? Yeah. Yeah.
I use this all the time, even in the room when patients say, like, y'all seen a lot of flu? And I can pull up and say, well, in the last 30 days, we tested 43 kids, 2 hospitals.
Yeah. So it was just commented that they use this report often for just identifying flu tests given, and how many were positive, how many were negative, and so forth. So yeah, any sort of test you can filter on with this report and get some useful info. All right, so we're going to move on from the sort of the operational reports and talk more about strategic oversight reporting. And this is where we're going to get into some measures and other information. So I want to start by mentioning that the Bright Futures Periodicity Schedule, you all probably know what this is, and there's a sort of a roadmap of screenings and services and opportunities, preventative care opportunities out there for you. So if you're ever wondering, okay, what should I measure? What clinical measures should I be paying attention to? This is sort of the roadmap for this. And I know you can't see this, but you guys have probably all seen this, but like towards the bottom here, you have dots that indicate the periodicity, like when they should be getting the fluoride varnish, when they should be getting the screenings, developmental screenings and depression screenings and so forth. I mention this and I bring this up because this is really defining, according to the AAP, and guidelines, when you should be doing certain services and the important ones that you might want to focus on. The dashboard. All right, so when you log into the dashboard, you got your financial measures that we talked about yesterday. You also have your clinical measures, and you have a clinical pulse that displays on the home page. The clinical pulse itself, just so folks understand how that score is calculated, this is all subjective. So we define a score for every measure, and then the pulse score is calculated. Basically, it just gives you the description of how that's calculated here. There's a weighting for every particular measure. Well visit rates we weight as 40% of your overall pulse. Immunization rates as 30%, and that's ADHD patient follow-up, sick to well visit ratio, diagnoses per visit. Those are the only measures that are included in the pulse, okay, the overall pulse. There's other clinical measures out there. We haven't updated this in a while, but maybe at some point we'll reimagine or recalculate the clinical pulse to include things like depression screening and other screenings. But right now, I just want to let you know, like, this is how that's calculated, with well visit rates being the most weighted measure of all of the measures included here. All right. The PCMH dashboard. Okay, so in the dashboard, there's a PCMH page. We added this years ago because for patient-centered medical home, just a show of hands in the room, who's done PCMH at their practice? So hopefully you all know about this if you've done it before. It's basically an organized list of all of the measures specific for how NCQA requires you to sort of report on things. We have a section that summarizes your immunization measures, your preventative care measures, chronic care measures, and behavioral health measures. So it was designed specifically for practices that need to do PCMH reporting. In the dashboard, this is its own tab, and there is an indication. So one thing that this page includes that many other pages do not include is like this percent change column. So there is an indication of recent trends. So for PCMH, you have to show that you're improving on specific measures. So that's why this is in there, but it could be useful even if you're not doing PCMH. What are my recent trends? Am I up or down over the last 3 months? So you can always see that on the PCMH dashboard. There is also the ability with some sections down here to break out measures easily by PCP or other categories, including insurance and race, ethnicity, and things like that. So it's a good, useful page to sort of summarize and work with measures specific for PCMH, but also for monitoring trends and getting other breakouts. All right, so let's talk about patients up to date on well visits. I may, in a second, I'm going to actually log into the dashboard and walk through that well visit rate page just to make sure everybody understands how that's calculated in all the different ages. But before I do that, I want to just mention, as we know, well visit rates, it's an indicator of recall effort and preventative care focus at your practice. This is probably the #1 indicator of preventative care focus at your practice. This and immunization rates as well. So only active patients are included in the dashboard. So when we do our dashboard data collection each month, and again, that's all refreshed once a month, we leave out patients that are not active, that have not had a visit in the last 3 years. We also omit patients that have inactive flags. So in your and I think I'm going to mention this in a second in a little more detail, but in your practice management, you have a flags table, patients and accounts. Individual flags in that table can be set to be excluded from reports. So you can define flags like hospital only or others as inactive. We leave out the patients with those flags in these clinical measures. So a low percentage of patient up to date indicates opportunity for more well visits. The EHR report library can be used to get recall lists. We'll talk more about that later. This was the inactive flag examples I mentioned. So hospital only, and this is in the practice management side is where those flags are maintained right now. Hospital only, or if you were doing a lot of COVID vaccines, you added a ton of patients that really aren't yours because you've been vaccinating kids in the community, there's a flag you want to add for those if they really aren't your patients. Otherwise, they're going to be included on your dashboard measures. So it's good to review those tables. One of the most common questions is that we get from practices early on when they start using PCC and getting into the dashboard is overdue patients that show in the dashboard. Sometimes they're flagged and sometimes they show with a specific flag that indicates they're inactive. Just make sure that you have these flags set to appropriately be excluded. And it's this question at the end. Exclude these patients from reports. Okay. If you're using flags, I forget, there was an example shared the other day of flag usage where you wouldn't want to exclude them, but you may still have that flag just to indicate that or have like an alert or some other reminder come up. Only exclude the ones that you know are inactive that should not be counted on clinical measures. Okay, so that's a little bit about flags, but let me jump over to the dashboard here, and I'm going to walk through that particular page. Okay. All right, so when you log into the dashboard, your home page, you have all of your different clinical measures here. We'll go through most of these, but well visit rates is really what I want to get at. Oh, I need to log out and log back in, I think. Okay. All right, so you should be able to see this up here. Well visit rates, we break it out into different ages. So patients under 15 months, patients 15 to 36 months, 3 to 6 years, 7 to 11 years, 12 to 21 years. And then below that, we have practice trends over time with a line for each age group. So yeah, just an explanation about each of these measures and how they're calculated. Skipping the under 15 months for a second, I'll come back to that. That one's a little more complicated, but other ones, it's just looking at active patients that have had a well visit for this age range is in the past 6 months. All right, have they had a well visit in the last 6 months? And then we give an overdue patient list option there. For the other kids over 3, it's did they have a well visit in the last year? Percentage of patients having well visit in the last year. And you can see for each of these, there are benchmarks. So we have the PCC client average showing, and then top 10%, and then some other HEDIS measures. The HEDIS measures, if you aren't familiar, they don't show for all measures, but these are national measure results, mostly reported by insurance companies to NCQA, I believe it is, and they report periodically benchmark results nationally as reported by insurance companies. So we have those results too. So we have measure results for commercial HMOs versus PPOs versus Medicaid HMOs. So you can see differences on those. Those benchmarks haven't been updated in a few years, just so you know. So some of these may have changed over time, but it's just another benchmark that is provided here. So kids over 3, it's looking for a well visit every year. Under 15 months, just to explain this, this is looking for patients who have had 6 well visits, 6 or more well visits, by the time they turn 15 months of age. So the denominator here, the qualifying patients, is actually patients who have turned 15 months old in the last year. So they're 15 months to 27 months currently. Okay, so for those patients, did they have 6 well visits by the time they turned 15 months? And that's what we're showing here. So if you're a new practice to PCC, and if you're a new startup practice for PCC, this is going to be 0 for a period of time, because you need to have, first of all, you need to be giving 6 or more well visits to patients by the time they turn 15 months. So it's common for new practices with PCC to have this as reported as 0. So if any of you see that, just know that it takes some time for this measure to be to have enough data to be calculated accurately. We do exclude patients if their first visit to you was after they were 6 weeks of age. So to get 6 well visits within 15 months, you obviously need to be seeing them early on. You need to be doing the newborn, the 2 month, 1 month, 2 month. So there's a few visits that happen early on there. If you have a patient that starts at your practice a little later, you're not going to have a chance to give them 6 well visits by that 15-month time. So we exclude patients that have a first visit 6 weeks after their birth date. All right, so that's a little bit about that measure. That one's a little different than some of the other ones. Detailed breakdown. So I want to point this out. For many of the clinical measures, you can drill into them into a detailed breakdown. We also show this on the PCMH dashboard. But you can get a breakdown by any of these different categories. So if you wanted to see, all right, what are my well visit rates for kids in this age group for Blue Cross versus Aetna versus Medicaid, you can get that here. And this is all based on primary insurance assigned to your patients. I will point out again, the dashboard reports are updated once a month. So these are results, in this case, as of 7/6. That's the last time the dashboard data was collected for the practice. So yeah, you can get breakdowns by any of these different things, by PCP. So if you wanted to see, all right, what are my well visit rates for this age group for one provider versus another, you can see that here. There's a graph for the provider breakdown where you can see an individual provider compared to the benchmark. Yeah, so I wanted to point that out, that detailed breakdown. On any dashboard page, you can quickly just jump to other measures here, by the way. All right, any questions on well visit rate measures, how they're calculated, or anything like that? I'm going to get into later on how to generate a recall list for patients within the EHR. Just know that like when you look at the overdue lists, all right, this is a good place to start if you wanted to get an idea of which patients are overdue. But keep in mind, this is as of 7/6. So patients that come in to your practice that get up to date, you may have some that have been caught up since this data was last collected. Or you may have some that you've given a flag to, you've assigned a flag to, that would exclude them from the next month. You may have done that since this data was collected. It won't go away automatically. You have to wait a month. If you're flagging kids as to be excluded from these measures, you have to wait a month for that to be reflected on here. All right, well, that's well visit rates. All right, I mentioned this, the under 15 months, and I mentioned the breakdown by different categories here. All right, I want to emphasize that clinical oversight, all right, of your practice strategic oversight, looking at dashboard measures, in particular well visit rates, leads to revenue opportunity. All right, there's so much opportunity out there for improving your revenue at your practice just by focusing on these measures and recalling these patients. I feel like Chip or somebody has probably done a presentation at this conference about recall strategies and ways to outreach strategies for your patients. I'm not going to get into too much of that, but having a recall process is super important for the revenue of your practice, okay? As you can see, I just did some math here, your practice too, and we have reports that I showed yesterday in the financial report. Figure out what your average dollars deposited is per well visit, all right? And you can break that out into different ages, all right? Just doing the math, you can see, okay, looking at the number of overdue patients as reported in the dashboard, multiply that by how much you get paid per well visit, and you can get some revenue opportunity here, all right? You're not gonna be able to fit all of your overdue patients in the schedule, but think about how you may be able to fit some of those, even some of those. Think about like the opportunity of that additional revenue at your practice just by recalling and getting some of those kids in. Does anyone here has anyone had success with implementing a recall strategy? I'd love to hear just a little bit about if this has worked at a practice or what impact you've seen at your practice. Yeah, all right. Can you come up to the mic? I want to hear a little bit about what you've done, because I think this is important.
Hi, I'm Michelle. We are new to PCC. We just got implemented last September. So just combination of learning the system, in addition to me being a new office manager, getting familiar with all my insurance providers and so forth. So we do a combination of reports out of PCC, but also too, we have the luxury of our Medicaid providers furnishing us with lists of those active patients who are overdue. So we have staff, front desk staff that are in-house. So what we did is we came up with an opportunity to employ an employee in Singapore. In the Philippines, excuse me. And so we give her the list. So there's a dedicated person for these overdue patients. She has brought in so many patients that we haven't seen. The latest one was since 2016. Okay, so all of these patients, where one family came in, there was about, I kid you not, 10 kids, because it was a blended family. So as a result, just by her getting that list, and then we marry it with what we have in PCC, and then we literally do, I call it dialing for dollars. I know that sounds weird, but but in essence, that's what it is. Yeah. She dials for dollars, so that is her dedicated role. She answers the phone as well, but then I'll say, okay, focus on these lists. Yeah. And then I come back and I'm like, oh my God, who is this person? And I look, hasn't been here since 2016, so they become a new patient again, but we brought in all of those kids as a result.
Absolutely.
So it's been great. It's been great.
That's good. Yeah. And any sort of downtime for staff at your practice, whether it's at the front desk or even the back office.
Is there a name of that service?
Oh, yeah.
Do I just do Singapore dollar for dollar?
We have our phone system is UMA Business Office. So as a result, she is able to connect to our phone system in-house. So as the phones ring in my office, they ring to her computer as well. Okay, so she is able to answer the phone as if she was right there. Okay, she sees PCC. She gets the voicemails that come through. She can transfer calls to me. It is a wonderful setup. Okay, they don't even know where she is. They assume she's in the office. So it has been nice. It has been nice. So I had to come up with a strategy because we're so busy in the office. We're a small mom and shop. Lee can attest to that. Okay, we have one doctor. one doctor, yeah.
Per location.
Yeah, two MAs, and then we have on average about 1.5 front desks that are in office, plus me. So as a result, we had to just get smart. What makes the most sense? You know, let's use someone who is not seeing patients and right in front of them and answering the phone. So it was the best thing. She's been employed for 2 months. I love her so much. I'm like, you're getting a paid vacation, 1 week on us.
Find her.
I found her through, it's Hello Raish is the name of it.
That's the one I've heard the other
Hello
day.
Raish.
Yeah.
We actually have 2 employees from the Philippines. The doctor's scribe is also through Hello Raish as well. Okay?
Yeah.
RACHE.
Yeah, this is a virtual assistant
Yes.
program.
Send me your contact information, I can send it to you.
Okay,
Yeah.
Okay.
I'll check my
Yeah.
thing. All right, here we go.
So,
Yeah.
I actually use this in a slightly different way, which is when questions come up around open panels, closed panels, and who should be accepting new patients or new babies. And so at least a couple times a year, I will generate a report for all of our PCPs with all of the ages and how up-to-date their patients are with their well checks. Everyone gets the report card with all of the numbers, the overall for the practice, as well as each individual provider. And then I also add from the patient population report the ages, the size and ages in their patient panel. I assume you're going to show that too. And that helps us have a little bit of data that we can base our decision on whether we should be accepting new babies or older kids or neither, et cetera.
Yeah. Yeah, having that breakout by PCP, you can get that right in the dashboard where you can see your well visit rates, how many patients are assigned to primary care provider. Yeah, so I'm going to talk later about how to generate the overdue lists in the report library. The dashboard has them. Keep in mind that some of those may have since been caught up. And you have the ability, actually, the other thing is the report library can exclude patients if they are coming in for a well visit. So you may not need to reach out to everybody that's in the dashboard list, because if they're coming in soon for a well visit, there's no need to reach out to them. So I will show how to get those recall lists a little later. But yeah, any opportunity or any downtime for with your office staff, it's absolutely great to just give them lists, get them calling patients, adding them to your schedule. Okay. Immunization rates, let's talk about that. So this also includes only patients without inactive flags, so it excludes patients that have those inactive flags that I talked about. Any historical and administered immunizations are included in the measure. So if you are giving these vaccines, they are included, but even if they are entered as historical vaccines not given by your practice, but entered as a historical record, those are included in these measures. Okay. The screenshot I have here is right from the PCMH dashboard where it summarizes all of the immunization rate measures we have. All right, I'm going to jump back to the dashboard. I'll walk through immunization rate measures, or a few of these here. So we'll start with the childhood immunization status. So here we go. Immunization rates for patients 2 years old. Okay, so what this measure is it's a combo measure. So it's looking for counting patients that are up to date by their second birthday for all of these vaccines. The DTaP, so there's actually, in this calculation, it's 9. We have another combo 10 calculation that I'll show in a second that includes influenza with those. But you can see by default, this measure is looking for how many kids are up to date on the series of 9 vaccines by their second birthday. So we are looking at kids that are currently 2 years old. So they're between 2 and 3 years old, okay? And of those, how many by their second birthday were up to date? If you do the view detail breakdown, you're going to get a breakdown by individual vaccine. Okay, so the combo 9 is the overall measure as reported in the dashboard on the home page there. But there is a combo 10, which includes influenza, which is generally, as you can see by the benchmark, is lower. Not as many kids get 2 flu vaccines by their 2nd birthday, or you may not have record of both flu vaccines by their 2nd birthday. Yeah, so you can see individual vaccine measure results in addition to the combo. And down here, you can get a list of overdue patients for each of those individual vaccines. Now, these are overdue at age 2, all right? They're not going to be, you can't catch them up and have them meet this measure, all right? They're going to be considered overdue because they didn't have it by that 2nd birthday, all right? They will come off the list. They will come off the measure when they turn 3. You also have the ability to compare to the top 10%. So this just gives you some graphical ways to show your practice compared to the top 10% or compared to the average PCC client. Any questions about the 2-year-old immunization rate measure? Let's look at the adolescents. So immunization rates for adolescents. All right, so this is another combined vaccine rate measure. So percentage of kids that are up to date on 1 Tdap, 1 meningococcal, and at least 2 HPV vaccines. And this is by their 13th birthday. So it's looking at patients that had those 3 series of vaccines by their 13th birthday. All right, just like the childhood one, you can get a detailed breakdown that will show you your results for individual vaccines in that series. So you can break out, you can get an idea of how many met the 2 HPV threshold, all right, versus meningococcal and Tdap, and overdue lists for those as well. So that's the adolescent, the combo immunization rate adolescents. You can get the individual, you can get a measure of just Tdap, you can get a measure of just meningococcal, you can get a measure of just HPV. So I will point out, we have a separate measure for HPV that looks at percentage of kids 13 to 17 now, because some kids may not get it by 13, but you may want to know, have I caught them up after their 13th birthday? This measure can do that. This will show all kids 13 to 17 that are up to date on the HPV vaccine as of the reporting date. Okay, so this will include. So it doesn't look at it as of the 13th birthday. It calculates if they're overdue as of the data collection date. Okay, you can view a detailed breakdown for this. And again, you can see a breakout by provider, or you can see it broken out by sex, males and females. This view, for some reason, is not separating out males and females. I'm not sure why. But you could also exclude patients with a current insurance of Medicaid. And we have that in there for some practices we know had to report on this measure for Merck rebate programs. So if you've ever participated with HPV rebate programs or something like that, where you need to report percentage of patients up to date and excluding Medicaid patients, you can do that in the dashboard. Just a show of hands, has anyone needed to report for that, any specific rebate program? Yeah, okay. I know those were around a few years ago, and I think they're still around. Okay, that's immunization rates. I think there's one other variation of this, which looks at patients currently 13 years of age. So patients currently 13 years of age, are they up to date on the HPV vaccine as of the reporting date? So it's not as of their 13th birthday, it's as of right now. So different variations of these immunization rate measures are available in the dashboard. Okay. All right, so I talked about adolescent ones. I talked about the childhood ones. Let's talk about depression screening. So we have a adolescent depression screening measure. And this is just showing you, all right, in that Bright Futures periodicity schedule, starting at age 12, for all adolescents, you're supposed to give that once a year. There is a CPT code for it, 96127. Hopefully you're all billing for that. Average payment for across all PCC clients, it's not much, but it's something. You should be able to get paid for this from your insurance companies. So there is revenue opportunity. If you are not billing for this, as you should be, there's a loss of revenue there. So this screening is, it's looking at percentage of adolescents that had a well visit in the last year and also had that screening code billed. All right. It's not just ordering it will capture it. You actually have to bill it with one of these codes listed here. Okay, this breaks out by PCP, so you can see that broken out as well. That's the depression screening rate measure. Infant developmental screening, there's a developmental screening measure that is basically looking for this. So at the 9-month visit, and I think also further out as well, but this measure looks between the ages of 6 and 12 months. Did they have a developmental screening billed with one of these codes? I think typically people do the 96110. Did they have it billed between the ages of 6 and 12 months for each patient? So if you're doing that at the typically people do it at the 9-month, I think as like an ages and stages questionnaire or something like that. That should get picked up for this measure. There is a PCP breakdown for that as well. Weight assessment and counseling. All right, so another dashboard measure. This is a standard measure in the pediatric world for patients 3 to 17 years of age. What percentage of them are having their BMI assessed at least once a year? What percentage are getting counseling in the form of nutrition and exercise counseling. The dashboard has this measure in here, and I'll just jump over here and show. All right, weight assessment and counseling. All right, so we break this out. We show a measure of patients that had the weight assessment, that had the BMI, performed, and most of you are really high for this because you typically take height and weight at your well visits. So this is just looking for one in the past year, okay? And it gives you a percentage for that. Nutrition and exercise counseling, are they getting one of these documented within the last year? All right, so there's no billing codes, there's no CPT codes for these unless you have like a nutritionist seeing patients at your office. There are ICD-10 codes for these that you should be capturing, but if you are in your dashboard and you see this really low, it's probably because it's that your order for those, your counseling order, may not be linked appropriately with a SNOMED code. All right, there's a specific code that this measure calculation is looking for. Actually, there's a set of codes that you could be using. If you're low on this, but you know you're doing the screening, check with PCC support because we have to make sure that we're configuring that order to be correct. All right, and I want to make sure you know it's not just billing the ICD-10 code for the counseling. You actually have to click an order in PCC and have that order added to your well visit protocols and have that order assigned in the back end to a SNOMED code. Okay. You can see the average, PCC client average is really low for that. You guys are probably doing this all the time, but it's that configuration and that requirement of having that specific SNOMED documented that is triggering this measure. Yes, question?
Is there any talk of updating those to where it may capture CPT codes?
I don't think there's any CPT codes billable for, but the ICD-10 codes,
Yeah.
yes, yeah. There is. So we built this measure based on the standard spec from a few years back. I think back then it didn't have the ICD-10 codes mapped to this, but I think that it does now. So yes, that would be a good wish to add to, because I think there are ICD-10s.
From 0 to a more accurate reflection, because
Yeah.
when I built all our protocols, we were not told that's how it was captured, so they had to get everyone to change their workflow or just let it stay at 0, even though we're capturing.
Yeah, it depends on if you need to report this to external entities like PCMH and other places, then yeah, you probably want to put an initiative into documenting this and getting it counted. But yeah, there are ICD-10 codes, and I think the new standard specifications for how to calculate this include those. So we don't have that on our roadmap right now, but it's something that would be good to add, pass that along, yeah, so we can make sure we prioritize that.
Tim, I have a question.
Yeah, go ahead.
A thought comment.
Yeah.
For the BMI and nutrition counseling and the physical activity, we started doing that a while ago through our biller. Our biller was telling us about that with the physicals, but also too, when I meet monthly with Medicaid providers, they give us incentives. So I have those reports that come out. And so it's a win-win for us because we're getting credit for the physical and then those three
Well,
things.
we are too, because
Yeah.
my physicals codes are already linked to the ICD
Right.
codes, because we're doing it every visit, so it's
Yeah.
meeting our incentives for all of our PCMH programs.
So they're picking up on it at the insurance
Yeah.
claim
Yes.
side? Yeah, okay, that's good.
But it looks bad on the dashboard.
Yeah, yeah. Yes, it would be good to update those, yeah. All right, any other questions about this particular measure? All right. Who has multiple locations at their practice? All right, good, about half the room here. The dashboard includes the ability to break out measure results by location. If you've done PCMH recognition, this is one of the requirements. It's kind of a silly requirement, in my opinion, for some things, because it's like, what if you have providers that are seeing patients at different locations or patients that go to different locations? Breaking out measure results by location can be a little silly, unless you have really separate locations that are operating separately. But you do have the ability in the dashboard, specifically for PCMH, to get a location-specific measure result. If you, I don't think the sample database has this, but let me just check. No. If you are in a multi-location practice, in the upper right, you'll see, just like in this screenshot over here, a location-specific or location drop-down where you can see your results for patients assigned to that location. And the way we do it in the back end is we look at the location of their last well visit, and we attribute the patient to that location. That's how that's calculated. That can be useful if you need to see your measure results specific for individual locations. All right, let's talk more about population management, and I'm going to get into some recall reports and into the EHR report library for this. All right, care plan management. Just a show of hands in the room, who uses care plans at their office? And you're updating them as patients come in. So only a few hands here. I don't have screenshots about the care plan functionality in PCC, but you can add care plans to the patient protocol. And there's a separate section of the chart where those care plans can be documented. You can add new care plans, like if a patient, what do you use the care plans for? What sort of Like asthma?
It's more for like referral notes and stuff they use it for.
Okay, it's sort of a workaround, yeah. Some people use it for tracking referral info. Anyone else use care plans? Or what do you use it?
Asthma and ADHD, Dr. Williams uses that.
Yeah.
Doctor uses that. And she uses the snap text to document all of that.
Yeah.
Have a template and all of that set up for PCMH reporting.
Yeah, for NCQA PCMH, you really need to use this just because they want you to show that you're tracking or doing care management for patients that are complex. So asthma action plans, nutrition plans, or anything like that, you can document a care plan in the chart. Is there a question, or do you want me to repeat?
Oh, just a reminder to use the microphone whenever possible, please.
Yeah. So that example that was shared was tracking asthma plans for PCMH. All right. In the report library, there's a care plans by date report that you can run to monitor patients with a care plan. So if you're using care plans, this will give you a list of patients that have a care plan. And it'll give you the detail, you can see in these examples, of the next steps for those, and some other notes and other information. So this is just good for managing patients that have care plans. If you want to figure out, all right, do I need to follow up with any of these kids that have a care plan? This report can be useful for that. Just to identify if it's time for a follow-up visit and so forth. So it's good for chronic disease management and care management for complex kids. So in the EHR, in the EHR report library, you can use the preventative care recall for getting lists of patients overdue for well visit. We'll walk through an example of that. You can restrict that to different age groups. If you wanted to reach out to adolescents, you may have a different message that you want to send to them as opposed to younger kids. Of course, use the broadcast messaging functionality within the report library to easily reach out to those kids. You can get a list and it'll automatically send a message, a customized message to those kids or those families. There's no extra cost for broadcast messaging. You can schedule recall lists, and I'll show you how to do this. If you wanted to, on a regular basis, on the first of the month, have the system automatically build that list for you, so you don't have to have somebody go in there and remember to go in there and change your criteria. You can schedule that to run for you, and all you have to do is just go and view it. Well visit recall. Let's walk through this, and I just want to make sure everybody knows how to run this and some of the criteria that you'll want to use. All right, so in the report library, all right, we're going to go in there and take a look in patient recall category. I know this might be a little small to see up there or out there, but we're going to look at the preventative care recall report. All right, so when I go in here, I'm going to walk through the different criteria that I'd use maybe for adolescents, so getting a list of adolescent kids that are overdue. I'll walk through doing that, and apologies, this is a little slow network connection, so it might take a little bit to run this, but by default, when I run this, the visit date, this is last 3 years. This is saying include patients that have had a visit in the last 3 years. All right, those are, I'm considering as active patients. I don't want any deceased patients. I want to exclude by flag. And again, this is where I can go and say, show me patients that are, or exclude patients that are dismissed, inactive, transferred or transferred to adult. Okay, so I can exclude those patients. All right, always exclude by flag. You can do the same for a count flag. Sometimes if you have families that are, you're adding the flag on the family account, not the patient, you can exclude those as well. Okay. All right. Physical due dates. All right. So this is going to, by default, show me patients that are due in the past through the next 90 days or about to become due. All right. I can change that if I want. I can say all past dates through the next 30 days if I wanted to limit that, but I'll leave it at 90 days. This is going to be everybody due or about to become due. Okay, and I'm going to restrict it by age. I don't want all patients. I want to really focus on my adolescents, for example. So I'll say, show me all patients 12, and depending on how long you see patients, up until 18 or up until 21, I'll go to 21. All right. You do have the ability to restrict by insurance if you ever needed to. I don't care in this case. I want all patients. But I do want to exclude patients if they already have a well visit, all right? I don't need to recall them if they're already scheduled to come in upcoming for a well visit. So I'm going to say I want to exclude patients if they have a well visit in the next, I'll go a whole year. Like just if they're coming up due in the next year, I don't want to see them here. But you can make that sooner if you wanted to. And I want to exclude patients that specifically had a well visit scheduled. All right. Just a shortcut here, you'll see your full list of visit reasons here. I don't want to have to go one by one and check these off. If I just search for well, all right, I've restricted this list to just the well visit reasons, and I can just hit select all. And I can review this and make sure, yeah, these are all well visit reasons here. So I'm excluding patients if they have a well visit in the next 365 days, in the next year. I don't care where they're going to be seen or who they're going to be seen with. I'm going to exclude them. All right, so that's it. I have adolescents due for a well visit that are not scheduled to come in. And I can generate that report. And I get my results. 366 kids in this case. All right, so you see the columns of, you see the information you have here. You can see if there's a next appointment date and next appointment reason there. If I look at my columns, these are the ones that I can select. If you do want to see more information, if you're ever generating a list and you want to include PCP, for example, I don't see that on this in these options. I can customize this report to add PCP, and I'll show you how to do that in a second. But if I wanted to generate a broadcast message for everybody in that list, I don't have it set up in my sample environment here, but you will see a broad or send message option here. And you can specify a text or email. So for broadcast messaging, you can send a text or email to all of the families on that list. Okay. All right, so getting a recall list, and again, I restricted it. Yes. Could you run up to the mic real quick? Yeah, sorry. No, don't run, just stand.
Do you know what last physical pulls from? Like, does it have to be a build thing, or can it use that little piece in demographics where you hand keyed, where they saw their pediatrician when they moved to you?
Yep. Where does the last well visit get pulled from? Right, you're wondering about last well visit.
Or due.
Or due date, yeah. So I'll show you. Let's go back to the EHR. I'll pull up one of these kids. I'll pull up this first kid. There is a component called recent and upcoming appointments for any patient. And you can see here, this is where the last visit and last physical are stored. You can change it. You can change their last physical and next due date if you needed to. The last visit and the last physical and the due date, actually the system automatically maintains this. So as you're posting visits, it updates the last visit date. If it's a physical, if it's a well visit, we have a configuration in the background that says these codes, build codes, are well visit codes. If it matches that, it updates the last physical for the patient. So it's all sort of automatically maintained. The due date is maintained based on a schedule set in the configuration in the background too. So we have a physical schedule. So, and you can see it's like a little over a year after their last is when the due date is set. But
So
you can
if
change it.
they're new to you, you have to dig that out of their records. And you have to use both fields, I understand?
Good question. So if they are new to you, a new patient, if you're, like assuming you don't have any history for them, right? You just maybe have some scanned documents and such. Yes, you would want to update that last physical date for them. The due date, I feel like the system may automatically calculate that. Lee, I don't know if you know, does the system for new patients, once you put in a last physical date, does it automatically update the due date? I feel like there might be a nightly process. Yeah.
I haven't seen it.
Yeah, it doesn't hurt to update it yourself too, and it would be a year after their last. So yeah, and that's a good point. I'm glad you asked that. For new patients, adding that date is a good thing to do. Their last physical date, just to make sure that for recall purposes that tracks appropriately. If you're new to PCC and you've done a data conversion, these dates should automatically be calculated for you properly. That's the other thing I'll mention. Okay, so back in the report library, I wanted to show about customizing this. So say you have a recall list, and again, I didn't have PCP in my output, but I want to be able to see the primary care provider. You can customize this list and just you can edit the columns. So this shows, okay, the checked off columns are going to show by default, but if I wanted to see insurance or be able to have the ability to include that data in the output, you have to customize the report and add those columns in. Most recent BMI, this could be interesting to see, I don't know. So you have the ability to add these other fields. Age at last visit, all this other stuff. So, and customize that report and want to save that, you got to customize it, you got to preview. You do need to go in here and say, oh yeah, I do want to see this in the output. And it will pull these columns in. If you want to be able to see those by default, that's what you would do. You would just select those and then save it. So by saving it, by customizing and saving it, the next time you will be able to have those additional columns. Okay, let me go back. I want to get out of customize here, and I want to show scheduling. All right, so I have my recall list here. Well, it looks like it forgot everything I entered before. But if you create your recall list and hit schedule, all right, this allows you to save that report and schedule it to run however often you want. So like if you want it run monthly or quarterly, you can specify if you want it on the first or the last of the month. Those are the only two options we have here. And the time of day to run it. All right. I'm not going to schedule this one, but if you do schedule it, I'll show you where those live. I go back out here. You'll see a saved reports tab. I don't know if I have. Yeah. So I see my scheduled reports here. These are the ones that I've configured to be scheduled. And then the saved results is where I'd go to see the report that had been scheduled and saved and automatically run. All right, so I have some saved ones that I've run in the past. Clicking on it will bring up the output. And I think once you click on it, you can specify which day. I'm looking at the results that were saved and scheduled to be run on 7/19, which I think was maybe yesterday, or maybe that's today. I don't remember. But yeah, you can specify if you want to look at results that were run on any date in the past. You just change that, and you'll see the list generated for that past date. So that's scheduled reports, saved reports. Yeah, so you can generate custom versions of this for different ages. All right. Does anyone have a process for generating these recall lists already? Has anyone set this up? I'm just curious if you run. Yeah, I see some nods. Have you scheduled it? Do you have a process where you have staff that are just reviewing the scheduled reports on a regular basis? Yeah, so that's a good process to have. To me, it seems like it's an efficient way of doing recall, especially if you're sending messages out automatically on a regular basis. Yeah.
Just going to tilt this. I'm pretty sure the answer to this question is going to be no. But tracking recall results, is there any functionality within the EHR? Because the best solution I've heard anyone come up with is, we go and put it into another program and we run a spreadsheet and then we search for duplicates and then we remove the duplicates and we see how many times we called them, da-da-da-da-da. Is there any more streamlined way or any functionality within the EHR that could help us track the recall results?
So when you say track recall results, you're talking about like who has been contacted, like a little bit more detail. Like when you have the list, you want to know who has been reached out to on that list. Is that
right? I want to run a list, and after I've done whatever form of recall I've done, I want to know how many of those people came in, who didn't come in, who am I contacting again. I want to be able to look and say, we've tried to reach this person this many times in these ways. And they are still on my list. And so we need to do something different, or maybe they're not our patient anymore. Also, tracking recall results is a requirement of, I'm on a different medical home program for my state than what most people are on, but it is a requirement to track for that as well and show the reporting.
Yeah, the closest we have is getting your saved results, so you can see the list of patients that were overdue in the past with your saved results. But no, there isn't really a way to track that in the EHR. The best way to do that is to export and manage in a spreadsheet. To have somebody documenting individually for every patient. Or as an aggregate, maybe for a particular group of recall that you've done, how many were actually followed up and scheduled and so forth. That would be nice. Like that. We don't have that ability in there, but you can see your saved past results of kids that were overdue in the past. Trying to think of any place in the EHR where you could document individually for patients.
So one of the things that we have done is use the miscellaneous notes. To say, okay, so we texted this person, we called this person, whatever. But then you're looking chart by chart rather than having a report or a spreadsheet. Yeah. So like I said, I thought the answer was going to be no. It's just something I've got to tackle in a better and different way, and I'm searching for tools.
Yeah, and I wonder if there's any tools out there, software tools out there that do organize that a little bit, where you could export PCC lists into something else to better manage that. But that's, yeah, not possible, but it would be great to pass that along to the wishing well, because I could see that being really, really useful.
So one way that we do it is we do like a phone message. We have a little snap text that says we send a text message or a postcard or something to that patient. And with the message, you can go back to your messages and type in like WCC reminder, and it'll pull up all those patients. And so it's still a lot of work, but it's a little bit easier. And because if a patient calls, because we've done a lot of recall, and said, hey, if you do not contact us, we're going to have to dismiss you. It's documented right there. You're in the chart. You say, this day I sent this day we sent you a letter, and now that you have the dismissal letter, now you're upset. So we have all the documentation in one place.
So you do it as a phone, you do it kind of like as a task, that you check off that you did it.
It's just a phone note. I don't really do that part, but that is kind of our process of it.
Yeah, that's good. So a phone note. Yeah, I mean, it's always good to track that as a phone note as you're contacting patients. And did you say you use a report to identify those phone notes? Like, do you?
So we go into like our messaging queue, and then I can't think of it right this second, but up at the top where you have like the search bar, I type in like WCC reminder, and it'll pull them all up.
Okay, so she was saying that the messaging queue, because they have WCC reminder, would be a task type? Okay.
You look around and I'll see.
Yeah, so that could be interesting if you have a way to, you're individually one by one in the patient chart, you can actually see as they come in, like, did you remind them, or what the status of that is. Yeah, that could be a good way to do it. Yeah, come on up.
So another way that we kind of try to work around it, when we get to the point where we send them a letter saying this is your well checks due, yada, yada, we scan the letter to the chart, and then they're all named well check WCC letter. So you can do a document modification report to search for that document. Now, the hard part, the laborious part, is going back and checking each letter to see if they scheduled. But
So you're scanning, what exactly you're scanning again?
so we scan whatever the letter is that we sent to them.
Okay.
We scan that into the chart, or print EHR, whatever.
Yeah.
And then label it WCC letter, and then you can run a document modification report on that letter.
So you're using, let me just pull up this report. And that identifies all of the letters that you've sent.
Yeah. It's not perfect, but it gives you an idea of who you should look at.
I just want, in case people are wondering what report that you're talking about there. Let me go here. Under documents, where is it? Is it clinical?
I think so.
Yeah, document modification report. When running that, you can filter on document categories. Are you putting it in a specific category?
It's been a little bit since I've run it, so
Let's see what it says here.
I think you could put a time frame in there, and
Yeah.
then
Yeah,
somehow I was able to pick the title of it.
yeah. I'm thinking you probably have a category where those are getting scanned into, and
Yes.
you're getting you can configure special categories here, and identify the documents put into that category. So, and then I think it will show you the notes for each of those documents, so that you could follow up on that. That's another good way to do it. Yeah.
I do have a question.
Yeah.
So we haven't found a good way for our like under 2-year-olds to do a recall with the patient recall reports, because they come in so often instead of yearly. Is there a way that we're missing, or are there plans to fix that?
You should be able to run your recall list specific for that age, and it should be smart enough to know, based on a configured schedule in the background, when they're due. So you're saying that it's not calculating when they're due appropriately?
Right. So like if they have to come in every 3 months, then like the report doesn't it doesn't work? Because my understanding was it does it yearly. So if you're overdue in the past year.
Yeah, it should, for kids under 3, it should be configured in the back end to have the appropriate schedule.
Okay.
So if that's not working, talk with support, because I think there may be something broken in the back end.
All right,
Yeah.
thanks.
Yeah.
Another way that we do it is if we do send letters, and like we're trying to get aggressive with it, we make flags on those accounts, and then we'll run a recall report or just a recall on those flags. And if they've came in for an appointment, then we can remove the flag and we can move on. So we have a report scheduled, I think it's every Wednesday. Front office gets it, and they'll remove the flags that like needs well child, no well child since, blah, 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 blah. They'll go ahead and remove those flags out. That's another way for you to kind of monitor that.
Yeah, tracking flags, yeah. Okay. Tori, was there another question or question on the?
Oh, no, I just had a
Oracle.
second mic in case we needed
Okay.
some additional mics.
Okay. All right. Good. So we talked about well visit recall. Let's talk about immunization recall or chronic condition recall. So there are other reports you can use, recall lists. So under patient recall, there's also chronic condition recall, which gives you an option to restrict based on diagnosis. So if you wanted to get a list of kids with a certain condition, certain diagnosis, this list can get that, or this report can get that. So it's very much the same. You would include or exclude by flag. So I'll just do a couple of these: dismissed, inactive, transferred. So I can exclude those kids, and I can focus on, what did I have in my example here? Yeah, I didn't have a specific one, but kids with asthma, for example, and I can focus on a certain age range. So say 3 to 12-year-olds or whatever age range you want there. You can exclude if they've come in for an appointment, but this is really what I wanted to show. So you can focus in on patients that had a certain clinical diagnosis. So I can search for asthma and get kids that had some sort of asthma diagnosis. And you can specify the date. So do you want kids with an asthma diagnosis within the last 3 years? Do you want to limit it to kids with asthma diagnosis within the last 1 year? You can do that. And the clinical diagnosis is the problem list. So it's actually looking for diagnoses added to the problem list. So it's not just billed diagnosis. You can restrict on billed diagnosis in the include by charges. You'll see diagnosis name here. So the clinical diagnosis is the problem list. This will get kids that have one of any of those asthma diagnoses active within the last 365 days. And again, you can use any condition with that. So I can generate this report, and this should be a list of kids with that specific diagnosis or with any of those diagnoses. Okay. Do you have a question there?
Yeah. So we were actually working on generating exactly that type of recall, and what we really wanted to see was kids with an asthma diagnosis that's active that are on a controller medicine, an inhaled corticosteroid. Can you, and not just like PRN albuterol, can you edit it down to that take budesonide or something?
You should be able to. Let's see. Include by, is there a prescription? There should be. There's clinical diagnosis. I thought we had restrictions for prescription, but let's let me try to customize this and see if, yeah, but I know what you're getting at. You can, restricting further on prescription, is that possible? And I thought it was, but let's take a look. Select criteria. Okay. I'm looking at the different criteria. Oh, yes. Okay. So if you customize that chronic condition recall report and select criteria, there is a include by prescriptions option. If I add that, okay, and now I will see where I can restrict on the dates and the specific drugs. This data, it should show all of your prescriptions that you have stored in there. But yeah, that would be, you're restricting it to patients with asthma diagnosis, but also including if they had a prescription in a certain time period as well. But yeah, so you just have to customize the report to get that to pull in. So if I wanted to save this, now that I've customized it, and chronic condition recall, say with RX restriction, I can do that. Also restricting to meds. And so now I have this new version. If I preview, it'll give me the list, and I can save it. All right, so I have this new one. I already put the name in and saving it. So if I go back to my report list, I'll see this new version in there with the criteria that I've already selected there. So that would be a good way to do that. Any other questions about like a chronic disease recall? Okay. Immunization recall, let's talk about that. Identifying patients overdue for vaccines. Okay. We have lists you can generate for kids due for a particular vaccine that are in a certain age group. So the overdue vaccine recall report in the immunization category would be the one you'd use for that. So you can go in, you can specify the specific vaccine, the age range, and so forth, and get that list. Let's take a look at it. So under immunization, overdue vaccine recall. This report will be smart enough to know it's based on the forecasting, immunization forecasting in the back end. So it should know and be able to identify kids that are due for a specific vaccine based on that forecasting. So again, I'd look at patients seen in the last 3 years. I can exclude by flag. Do that real quick. Dismissed, inactive, transferred. And then I can say, okay, if I want my, I don't know, kids 11 up until 13 years that are due for an HPV vaccine, I can get that list. So I'm restricting it to 11-year-olds through 13-year-olds, or up until age 13. I'm going to specify my vaccine family, which is HPV. Okay, I'm going to say I want them, if they're due or overdue for the HPV vaccine. Okay, maybe I want to exclude them if they're coming in soon for a well visit because they're probably going to get it soon. So let's say if they're coming in the next 90 days for a well visit, I'm going to exclude them. So I filter on well, I select all of those. Let's also, sometimes they can come in for maybe an immunization only visit. And if they have one of those scheduled, I'll exclude those as well. All right, and generate that list. So this should give me a list of kids that are overdue for HPV. It tells me the dose that they're overdue for and the recommended date when they should get it, according to the forecasting in the back end. Okay. So again, you can customize this report, add different columns and so forth. Yeah.
Tim, I have a question in regards to this, the immunization forecasting. I'll be very honest with you, we really don't use it. because we go out to the state's registry and get all of our stuff. It's just easier for the staff right now, but I would like to start utilizing the tools that we have in PCC. Is that automatically updated, or you have to push a button to do so?
Yeah, the forecasting is happening in the back end. Every time you open a chart, it checks to see the forecasting for the patient.
Okay.
And I'll pull it up in a second here, showing, just so everybody knows. I don't know if this test database has it, but like when you go to the immunizations and the history, there should be a forecasting section, forecasting results underneath the full vaccine history. That's constantly being updated. All right, every time you open a chart, it checks to see if they're due. It's always good to reference this. In terms of the registry, so you said your staff are often, they're going to the registry to figure out what they're due for. I think you're better off using this because it'll save some time. If your practice is set up bi-directional, with bi-directional connection for the registry, I'm not sure which state are you guys in? Florida. I think we are. I think we're set up with that. There is a button that you'll see that says retrieve vaccines. So that will actually automatically send a message to the registry, pull back vaccine records, and allow you to import those in. Always good to do that if you're set up with that connection before you're looking to see what they're due for. But yeah, this should be accurate, and it's constantly being refreshed. And it refreshes right when you open the chart. Getting back to the report, you'll get your output and the dose that they're due for. You can do this for any vaccine, for any age group. If you're wanting to identify kids that are due for vaccines and to get a hold of them to have them come in, definitely good to do. And this is great to do for improving your measure results too. I mean, this version that I did for HPV will get anyone that's about to become 13. If you want to get them up to date by age 13 to improve that measure result, a list like this and reaching out to those patients would be good. Same thing for 2-year-old vaccine. 2-year-old, if you want to identify kids that are overdue for any of the vaccines in that combo that they should get by age 2, you can do that as well. You're not limited to running this for just one vaccine family. All right, you can go and select multiple vaccine families when you run this, and it'll look for kids due for any of those vaccines that you've selected. Okay, so that's immunization recall. We talked about scheduling, sending messages, and scheduling reports. Are there any other questions before I do a Slido poll? Come on up.
Questions. Can you do bi-directional updating before you run that report on all your patients, so it is like very, very up to date?
You cannot. No, there is no way to do a batch submission for bi-directional, because the reason why not is because you have to import. There's an import process. You don't want to duplicate vaccines that are already on record. When you run that report, though, it should be checking everybody. It should be forecast or reforecasting everybody on that list when you run the report.
Went to CVS and got it, and so
you wouldn't have some of those other days. So no, there isn't a way to import everybody's records as a batch. And my understanding is that there's always that sort of import. You want to make sure you're not duplicating records. You got to check off what you were actually wanting to import.
Okay. And last question, on Monday I have a new physician starting. What clinical reporting should I do to kind of check on them?
To check on them. Okay, so the question is, new physician starting, what should you be doing to check on them? The first thing I would say, and this is more of a billing related thing, all right, they're starting, they're going to be charting their visits. You want to make sure they're charting their visits on time, right? So I want to point out, I talked about this in the financial reporting. We have a encounters by billing status report. You want to know, are there any visits that they are waiting to be billed for that clinician? So if they're new to the EHR, they might take a little longer to chart their visit and bill it. But under billing, you'll see this encounters by visit status or billing status. And so this is a good one to look at on a regular basis. And really, it should be used for everybody, not just new providers. Some people forget to.
I run that, but I'm thinking I may need to run it more frequently for him.
Yeah.
Early on.
Yeah, absolutely. And you can schedule it to run for him. So you can have this report, schedule, like limit it to the provider and schedule it to run every day if you wanted to for a specific time frame. Maybe not every day, but maybe like once a week, just so you know you have it. So that is a good one. I don't know, any other ones? I'm just thinking of documentation. Anyone have, yeah?
What's on the drop down under encounter type? Because technically you could bill it without signing it off and finishing it. I mean, sometimes I see billed ones with no physical exam.
Yeah, so they build it without a well visit code. Yeah. Encounter type is just, like visit is the most common one, but you could have a portal message or phone note, hospital or billing. So typically you're just including all encounter types, but the status is like if it's been posted. Posted means the billing office actually posted the charges. If it's like not ready, would be those that the provider had not made ready for billing. So, yeah, I mean, you can't really use this to catch code, like if a visit missed a code or something like that. You'd almost have to like spot check some visits. So that might be another one is like, on the schedule screen for them, just to make sure they're coding properly. I don't know if I have any here, but once the visit's billed, it says complete or billed here. You can click on that and see what was actually billed. I'm just looking to see. I don't really see any that were billed in this test database, but looking on that, you'll see the code. So spot checking codes, making sure they're capturing all the visit codes they should and so forth is good to do.
So is there a report that can show both the billing status and the signed status?
Is there a report that shows the billing status and signed status? What would you be using that for?
Because they billed it and they actually finished the note as opposed to billing it and I'm going to finish it tonight.
Oh, I see. I don't know if the so the billing status, so you'd want to maybe see those that were billed but not yet signed. I'm not aware of a report that does that. But let me double check. I want to see if I customize that, if that has another. Let's see. Customize report. And select criteria. No, there isn't any other signed status in here. So, yeah, it wouldn't. That would be another wish to add in here is to see a signed status along with billing status. I'm not aware of any report that can restrict on signing status. I feel like
we had to use it when a guy was about to retire who was not good about closing his notes. So it was a combination of looking back through all his visits. I mean, you can run what he hadn't billed, But then we had to look back and say, okay, these you haven't actually signed and or finished, even though they're 6 months old or whatever.
Yeah, you can see on the signing queue, like, so you can filter down to him, down to an individual provider and see those that are not ready to, not yet signed. So this doesn't have billing status in here. It's more like what's waiting to be signed off on. But yeah, I'm not aware of something that has both billing and signing status together. Any other questions about reports? General questions? I have a Slido poll because I'm curious. What clinical areas of your practice need more oversight? So this should queue up a QR code. So if you're here or at home, I'm interested to hear, based on everything I talked about today, all the different reports, what resonates the most? What do you want to focus on the most when you get back to your office? When you go in here, you may have to select Maroon Peak to see this. Yeah, chronic conditions. Yeah, I think there was some really good discussion earlier about recall processes and strategies. So there's a lot of different ways of doing recall, and I think that would be. And I want to emphasize what I said before earlier on. Like, there's an opportunity for revenue with recall, especially for well visits. With the amount that they get paid on average, it's substantial. Yeah. Yeah, so I'm happy to answer any other questions. I'm going to stick around. We have until noon. Lunch starts at noon, about 20 minutes or so. I'm going to stick around here. If you have reports that you need guidance on, or if you want to play around with some reports on your system, you can connect to your system on either the laptops here or your own. I'll stick around. I'll go around and help you out if you need help. Sabina's in the back. Maybe she can help. And yeah, but we're happy to help. Or answer any other questions. Thanks to everybody that attended virtually.